Hello, we are SNU Vision, 진솔대야 도현 Seunghwa from SNU, and we'll be addressing the issue of summer health. I am Seunghwa, and I'll begin the presentation with a short summary and then define the main problem of the case, along with a short analysis of summer health. Summer health is at a crossroads, deciding whether to adopt AI and to what extent. The company also must provide an integrated UI for physicians, along with new market risks arising. We figured Summer Health should expand its customer base, enhance its profitability, and integrate AI into platforms step by step. Through this presentation, we will introduce a range of strategies starting with short term, progressing to midterm, and ultimately leading to long-term solutions. Our team decided that the main problem of the case would be how can Summer Health expand its customer base? We believe through expanding the consumer base, Summer Health would be able to make specific decisions on step-by-step AI adoption. Increasing the volume of customers is an urgent issue for the company since the paid membership rate remains very low. In addition, a lack of data leads to high dependency on big tech companies, so unless the customer base grows, AI adoption would be a costly, low return investment. Hence, the short term goal would be to focus on expanding the user base before scaling AI. The midterm goal would be the partial adoption of AI with diversified price models for better monetization. Although immediate transition to an AI-first company is not recommended, industry trends indicate that AI adoption is, in fact, inevitable. American consumer skepticism towards AI in healthcare does remain high by around 80%. People are especially concerned about generative AI making mistakes in medical contexts. However, that concern drops if the generative AI model is developed and constantly updated by doctors and clinicians. Conversely, American physicians demonstrate greater acceptance of AI in healthcare, with approximately 68% supporting its advantage. In addition, the AI healthcare market is projected to grow up to 165 billion US dollars. Therefore, we propose that Summer Health's long-term goal should be AI integration, but AI integration should, however, be following the planned expansion of the customer database. As a small-scale startup, Summer Health can quickly pivot its strategy to seize market opportunities step by step. Summer Health has obvious strengths such as addressing the uneven distribution of pediatricians across the US. Meanwhile, the lack of real-time care limits the customer experience. It also competes with renowned competitors, therefore strong differentiation and positioning are required.
I'm Jaya, and I'll point out three challenges Summer Health is facing and introduce two out of the four strategies we propose to address the challenges. First, the previously targeted market of infants and toddlers is constantly shrinking. We suggest partnering with retail health clinics and pharmacies. We also advise tapping into the child and teenager market by entering the pediatric mental health and chronic disease sectors. Second, Summer Health is going through low profitability. We advise diversification of the pricing options such as AI-only services, physician-assisted plans, chronic disease subscriptions, and flexible short-term plans. Third, Summer Health has technical weaknesses. We encourage the company to first expand the customer base and collect data, positioning us for future collaboration with big tech companies. This will allow the company's sustainable growth and competitive edge. The first strategy is to build partnerships with retail health clinics and pharmacies such as CVS and Walgreens. A user would have to go through the following steps. A physician on the platform would write a prescription and opinion letter. The platform would automatically introduce retail health clinics or pharmacies open near the patient. The patient would receive physical follow-ups such as medication, injections, and lab tests in one of the recommended clinics. The cooperation holds incentive for both Summer Health and the potential partners. As for Summer Health, the company can physically reach the exact target market and improve customer acquisition through paid ads and word of mouth approaches. States and counties with fewer doctors' offices tend to have more retail clinics. Physical ads would also become approachable all over the country through these partnerships. On the other hand, Summer Health is bringing a new set of the customers, especially to partners without pediatricians nearby. Summer Health could also share customer data with its partners. The second strategy is to add mental health care functions such as children and teenagers. Summer Health can provide customer satisfaction by providing easy remote diagnosis on, for instance, autism. Statistics shows that 1 in 36 children in US has autism. Autism can reliably diagnosis by age 2 and average age of diagnosis in US is 5 years old. Since autism has become more common and can be discovered in a young age, parents are more and more concerned about their children's mental health. However, developmental delay can be mistaken for autism due to overlapping symptoms between the two. So, we anticipate a high demand in the market for autism testing. We suggest a three-step solution for autism testing. First of all, through the partly adoption of the AI could ask a customer about speech development, social communication, and developmental history. If AI detects no issues, the session ends with the message saying, please visit after a few months if needed. But if more observation is required, the parents can chat with certified doctors. If no problem is diagnosed during the chat, the session also ends. But again, if more observation is needed, the app suggests a face-to-face appointment with a doctor. This can also be applied to teenagers' depression. Summer Health can provide regular virtual follow-ups for continuous monitoring and care. The point is that Summer Health can easily provide patients with continuous monitoring. Teenagers might avoid regular visits to psychiatrist offices due to high cost, lack of awareness, and sensitivity towards others. However, text-based monitoring can help solve their problems. It is relatively less costly, repeatable, and remote care. Summer Health could put ads on social media to reach teenagers and advertise its beneficial aspects.
I am Doyan and I will introduce the remaining two solutions. Our third strategy is to introduce a kit-based subscription model for chronic care, aiming to expand our customer base by engaging long-term users. The care flow is based on an assumption that a simple AI chatbot was introduced, but the model can be modified and applied as a chat with a doctor. Here's how the care flow works. An AI chatbot suspects a chronic disease and recommends a kit-based subscription plan. The kit is delivered to the user. The patient could easily enter data for tracking via the app, such as the key metrics and medication intake. If any abnormal data is detected, the patient is connected to a doctor. Also, the system automatically generates weekly and monthly health reports based on the SOAP notes. Users are required to get virtual follow-ups every 3 to 6 months. To keep users engaged, a reward system could be introduced based on attendance and regular tracking. To make summer health service more accessible and engaging, we advise to introduce tiered pricing. We're offering a 7-day free trial so users can experience the service risk-free. An AI-powered plan accommodation will help users find the best pricing based on their financial situation and health history. A point system will reward consistent usage with discount and benefits. Our pricing includes a base plan with 24/7 AI chat supports, a premium plan with unlimited doctor chats and video consultations, and a kit-based plan that provides at-home medical devices with expert consultations. With all these features, Summer Health allows American healthcare to be more personalized, affordable, and accessible.
I'm Chinsor, and I'll point out the KPIs and financials. We've outlined 6 key performances indicators across 3-year and 6-year timeline within 3 key categories. First is the number of paid customers. We aim to reach 2,000 paid customers in 3 years and about 10,000 customers by the 6th year. Second is the size of the revenue. Our target revenue is approximately $250,000 by year 3 and $3.32 million by year 6. Last indicator is the annual growth rate of the company. We expect about 200% growth rate over 3 years and a more than 1,000 growth rate over 6 years. Now, moving on to the financials. The revenue stream comes from advertising revenue from retail clinics and the pricing model for each user. While costs vary, we primarily account for API costs. With our strategies in place, we project net revenue of $321.6 million by 2030 with a CAGR of 67.8%. This allows us to successfully achieve our KPI goals. Lastly, I'll explain the limitations of our strategies and present the implementation plan. We recommend that Summer Health should be prepared for the potential limitations of the strategies we have suggested. Revenue sharing with partners can lead to conflicts and higher marginal costs. This could be solved through tiered revenue sharing. The more referrals, the more revenue for Summer Health. Regulatory issues might arise regarding prescriptions, referrals, and lab tests. The platform could notify doctors of the state in which a particular patient is located, along with the corresponding regulations. Providing kits for tracking various types of chronic diseases may be financially unrealistic. The solution would be targeting particularly to high-demand diseases, such as pediatric asthma, atopic dermatitis, type 1 diabetes, obesity, and allergic rhinitis. The way of the kit supply should also be discussed, for instance, OEM. Free tiers in price tiering could potentially become a financial burden. Conversions into paid customers should be ensured. The following could be tried: free trials for a limited period, requiring card registration before a free trial, and providing customized pricing plans based on data analysis during the free trial. Economy of scale is the way. Thank you. We are SNUvation.